new parents to be, I welcome you to the New Mom School. New Mom School instills confidence, emotional confidence and technical skills with mindfulness to help the baby grow. How do we do this? I'll give you a few tips. At the time of delivery, golden hour is very precious. What is the golden hour? Golden hour is the first hour after birth when the parents bond with the child. The father is dressed with all aseptic measures, standing next to the obstetrician, ready to cut the umbilical cord. Then the baby is placed on the mother's chest to lick the first colostrum. Then the baby is shifted to the nurse's station. While the cleansing is happening, the pediatrician helps to give confidence to the father to shorten the length of the cord. This is how we bring bonding between the parents and the newborn. In order to welcome the newborn at home, there are 5 to 6 classes in which we teach you how to furnish the baby's room. 6 essentials needed for the baby's room are the bassinet, the humidifier, the diaper changing station, the lactation support system, the massage tray, and 6th is the medical kit. Bassinet is very appropriate for the first 4 months. It has a snug mattress with a snug cover. We are frightened that the baby should not suffocate with excess bedding, so the mattress is tightly adhered with the cover, and we provide a pillow with lots of mustard seed so that the skull becomes rounded. The child has molded along the birth passage and may have a little wonky head, so the mustard seeds help in grounding of the head. Along with this, attached to the bassinet is a pouch which contains the sanitizer. So before you use or pick the baby up, please clean your hands with the sanitizer. It is important to have the humidifier in the room, which could be seasoned, treated or diffused with lavender or rosemary or menthol or even Vicks Vapor Rub. To adapt to the needs of the baby, if the baby is complaining of cough and cold, you could season the humidifier with menthol or Vicks Vapor Rub. Otherwise, you could use the other natural oils. This would really give a good treat to the baby. Next comes the diaper station. The diaper station carries the appropriate size of the diaper because the baby keeps changing size, weight, growth. So you've got to see which diaper is appropriate for the baby. Keep wet swipes, 2 creams, one for the nappy rash and the other is to lubricate the anal orifice. If the baby has constipation and you apply this cream, it will facilitate the blowout job. And if the baby is suffering from diarrhea, that area is very sore. So if you lubricate that area, the child feels comfortable. So you need to have the diapers, the swipes, the 2 creams. This should suffice. Now along with this, there should be a dustbin. The dustbin should have a sliding door so that it becomes airtight. Now when it has to have 2 compartments, one for the diaper and the other for the swipes, and it should be tightly shut so that there is no brewing of infection. Once we've seen the diaper station, let's move on to the lactation support system. For this, you've got to install either an electric pump or a manual pump, and depending upon the flow of the milk, you need either 2 pumps or you need 1 to store the milk and to be used in the night when the mother can sleep. There should be provision for 2 nipple shields so that we can facilitate the mom not to have a crack in her nipples, because that would put her off. Along with this, she should use creams to lubricate the area before and after feeding. If she uses before, then please clean the nipple area and then breastfeed the child, and afterwards you could allow it to remain for some time. Along with the lactation support gadgets, I would advise the mother to use a lactation cushion. This is a cushion which is supported, strapped to the back of the mother, and it carries the baby, so her hands are free. So with one hand she uses to hold the baby's head and compress the lips of the baby to the breast tissue to make an airtight film. And with the other hand she milks the breast so that baby does not have to put a lot of pressure. Along with this, there's a small gadget which has come up in the recent years. That's a wedge cushion. If you apply this cushion on the undersurface of the breast gets elevated and comes at par with the baby. So the baby doesn't have to, search for the nipple. So you facilitate it. Once we've talked about the diaper, the lactation, let's go to the massage tray. The massage tray is a small tray with elevated edges so that the baby does not slip, and we use a linen on it which is rubber in texture but topped with cotton so that everything gets soaked and does not cause irritation to the skin. You could use any of the medicated oils for the baby, or I personally prefer coconut treated with camphor, and I tell my patients to apply on the undersurface of the joints, because the baby, when in mother's womb for 9 months, is subjected to rigidity. So you've got to make the joints flexible. So you've got to nurture the undersurface, relax the tendons, the muscles, and then bend the joints to and fro so that they become supple. This is done. Now we go to the medical kit. Medical kit should have Smithicon drops or Bonison as per your country. Some have restriction. Along with that, there should be a nail cutting scissor. Some attach microscope lens to it, not microscope, I'm sorry. They attach lens to it so that the nail is magnified. Very often in the night, mothers would like to put mittens on the baby, that's child gloves, so that the child does not scratch the face. Along with these ingredients, you do have to take care for the umbilicus, which is yet to fall. The cord is yet to fall, so as per your pediatrician's advice, you make provisions for that also in the medical kit. This is just the tip of the iceberg. There's a lot to know, but I will end it by telling you that to enhance milk support for the baby, the mother should have water treated with fenugreek and ajwain, lots of prunes, coconut water, red lentil soup, and small fishes. This enhances the milk flow to the body. And well, you have to now join the new mom school to experience more.